Hello, everyone. I'm Bert Eichel, the health officer of Mobile County, Alabama. It's a pleasure being with you this afternoon. First of all, we need to talk about the governor and the state health officer have extended the current situation order until May 31st. And this is be safer by distancing and avoid large gatherings. So that will expire at 11:59 p.m. on May the 31st. So the governor's newest proclamation, continue doing what we're doing now. It's very good, and I thank everybody for taking COVID seriously. The Mobile County Health Department is now in compliance or in conforming with, is conforming with the state health department's change of giving daily activity of when actual cases occurred. So you'll see a new format in our daily report, a new form. That's because the Alabama Department of Public Health has changed from just the day the test was reported to the ADPH to actually the date that the case occurred on. So note some few changes on that. Overall, COVID continues to have increased activity in Mobile County, Alabama. We have right now, at the high point, we had 276 persons in the hospital, and as of today, we have 29 persons in the hospital. So that continues to go up for what our low point was about 16 to 18 persons in the hospital. It's gone up right now to 29. Percentage-wise, that is a significant increase, but it in no way challenges our hospital capacity to treat persons with COVID-19. Also, within the community, we have an increase in community transmission rate, which means the number or the percentage of the people tested, what percentage of them are positive. So we think we're starting to feel the effects of spring break of individuals who have traveled outside this geographic area and have come back. But the mortality rate, the death rate remains really low. Hospitalization rate remains low. So I think we're in a relatively good position. We've continued to provide testing and providing COVID vaccination. One thing that we need to note is tomorrow that we will be giving Pfizer vaccine at the Newbern Clinic, which is 248 Cox Street, from 8:30 in the morning till 3:30 p.m. Anytime you want to know what's going on as far as vaccinations, please look at mchdcares.org. Repeat, mchdcares.com. Okay. If it's not .com, look at .org. But anyway, so thank you very much as we're going forward. But look at where the vaccines are available, and please get vaccinated. As we go forward, we want this to be a 4th of July that we're independent of COVID-19. There's a lot of excitement about travel, cruise industry coming back, but that's going to be for fully vaccinated persons. We're also looking to increase in air travel, a wonderful way to go see friends and family. But again, we highly recommend you be fully vaccinated before you travel. It's not a requirement at this time by the airlines, but international travel just announced this week that travel between the United States and Nassau in the Bahamas was permitted by Nassau and Bahamas if you're a fully vaccinated person. So incentive to get vaccinated is very real. I had an older person ask me a question, registered nurse, and said, we just don't have enough long-term data about being fully vaccinated. My comment to her was all the doctors in Mobile have taken the vaccine, or 95% have taken the vaccine. And if the person that you really stands by your bed and cares for you when you're sick, respect their opinion and ask them, have they taken the vaccine? So if you're considering taking the vaccine, please get the opinion of your private doctor to make a good decision. It works. It's something that's important, and thank you so much for taking this seriously.
One question. When should a person that got COVID 2 weeks ago get vaccinated?
Question. Good question. If you have recovered from COVID, how long should you wait before you get vaccinated? And that's a minimum of 2 weeks from the time that you recover from COVID. The interesting thing is that you recover from one type of COVID. You probably have immunity for a period of time from that particular strain of COVID, and it may have a little cross reactivity to give protection to the other strains of COVID. But please get vaccinated if you are fully recovered or it's been at least 2 weeks since you had any symptoms of COVID. Go ahead and start your COVID vaccine series. It does protect you against the variant strains of COVID. Another question I got asked was, where did this COVID-19 come from? And really, we have MERS and SARS, which are human-to-human transmissions of the coronavirus that have been around for a long period of time. The good news is COVID-19 is not as harmful as MERS and SARS. So this is not our first COVID virus that has caused from person-to-person transmission. The virus morphed many years ago. This is our first experience with this particular form of the coronavirus, which is, we call it COVID-19 because it came about in 2019. So we've had MERS and SARS, which were very virulent, which means it made a lot of people sicker, that were human-to-human transmissions of coronavirus. There are also several strains of the coronavirus that cause cold, but this is a unique virus that we have to deal with now. The strain we have seems to be changing a little bit from the original strain to the B.1.1.7 form of the virus, but there are many of the other variants out there. So please, please, please get vaccinated. Protect yourself, protect your friends, protect your family, and encourage others to do so. Thank you very much.
And only Mondays going forward for updates.
Oh, also, we're going to be doing Facebook Live only on Mondays from this time forward. So later on this week, we will not have another Facebook Live edition. So again, thank you very much, and we will look forward to an opportunity to visit with you in our vaccine clinics.